I'd like to speak to you today about restorative neurostimulation for refractory, nociceptive, or mechanical chronic low back pain. And I'd like to start by pointing out that this is a new class of therapy. So the therapies that we're typically familiar with, spinal cord stimulation, dorsal root ganglion stimulation, those are palliative or symptomatic therapies. This is a restorative or a disease-modifying therapy that functions by restoring muscle function, neuromuscular control, functional spine stability, in order to result in improved function and decreased pain. And these are the folks around the world who contributed to the work that we're going to look at today. And it really was a team effort. We did these, the main study that I'm going to show you, we did at 26 sites around the world, 4 in Australia, 6 in Europe, UK, and 16 in the United States. And these are the people who did that work.